Alfie here once again at Vente Pain Relief Clinic, and I wanted to talk a little bit about treatment sequence. So what does that exactly mean? So as a massage therapist, a good example is like when somebody comes in with lower back pain or hip pain, the therapist might choose to work on the lower extremities first and work their way up towards the hips and the glutes. In other words, they'll work towards an area that is painful by working on less painful or less symptomatic areas first. Another way to look at treatment sequence is, for example, somebody comes in again with lower back pain or lower back tightness, hip pain. The person, the therapist, might work on the muscles around the area. So the glutes, it could be just the lower back muscles to help treat that area. Now, the issue is that if, say, the root is not necessarily the muscles or the joints, but it is rooted more in the fascia. So the fascia is the connective tissue. It surrounds bones, it surrounds muscles, it surrounds organs. It basically connects everything in the human body together. Now, if the problem is the fascia primarily and the muscles are more secondary, or it could have happened where the muscles were primary first, or the joints or the nerves, whatever, were primary first, then the fascia became worse and became more exacerbated the person's symptoms. So if, say we treat the muscles first or the joints first without treating the fascia, what I've found in the past is that it actually, you may get less positive results. So from my experience, I think if the fascia is skipped, the connective tissue is skipped and and then the therapist decides to work directly on the muscles or the joints ahead of working on the fascia when the fascia is really tight, I've found that the symptoms tend to not get as well. Whereas if the fascia is the primary tissue that is the problem and it's treated and the focus is on the fascia, there seems to be a more of a long-term effect. So a good example, somebody has come in to see me and they complain about lower back pain or hip pain and they've had it for a number of months and they've gone to multiple treatments. The one thing that I realize on the first touch when I work on those areas is that the connective tissue is very tight, the fascia is very tight. As soon as we release those areas, as soon as we really focus on the fascia, there tends to be better results. There tends to be like a more longer term effect. Anyways, it's something to think about, like if you're suffering from chronic pain or have a chronic injury and you've had it for a number of months, treatment sequence. If you've got questions, please feel free to email us at admin@ventepainrelief.ca or phone us at 416-644-8894. Have yourself a great day. Take care.